Health Minister, a special responsibility for care. And that's Helen Whately, who joins us now. Good morning to you.
Good morning.
Good morning. Do you think that parliamentary scrutiny of a government lockdown and other restrictions would improve or basically make worse any of the government's plans?
As a member of Parliament, I clearly think parliamentary scrutiny is a really important part of our democracy. And what I'll say is that over the last few weeks, through the months of the pandemic, there feels like there has actually been a huge amount of parliamentary scrutiny. I've lost count of the number of statements that the Secretary of State for Health has made and urgent questions that he's made to Parliament and answered hundreds of questions from members of Parliament. Similarly, the Prime Minister has made statements and other ministers have as well and answered questions. And also the changes to the regulations have indeed been debated as well. So there has been significant scrutiny, and of course there should be scrutiny going forward.
Well, I mean, scrutiny, asking questions and getting to debate things is not the same. I get to ask questions of ministers, doesn't mean I get to have a say over any measure that happens. And of course, we tend not to have any discussion either in the media or indeed in Parliament until after something has been announced. This time round, it looks like we might get some early warning. The Times reports today that an emergency lockdown plan to ban socialising is on the cards across most of northern Britain, potentially London as well. Mr. Sadiq Khan seems desperate to lock down the capital city, effectively looking at all pubs, restaurants and bars being ordered to shut completely, forget the 10 p.m. curfew, completely shut for 2 weeks initially, households banned from meeting each other in indoor locations. How much scrutiny are we going to have of that, and how much science is there to back up the demand for that from the government?
Well, there is a debate on coronavirus in Parliament today, and no doubt that will be discussed there. And what I will say about that story that you're talking about is that, of course, we have to look at what restrictions may be needed. But we have recently put in the rule of 6 and tightened up on several restrictions, and, as is much covered today in the media, tightening up enforcement. And we've done that because we're seeing the rates of COVID rising. We had the briefing from the Chief Medical Officer last week about the very serious situation of rising rates and rising hospitalisation of people as well. And we know that that can very sadly lead to more deaths from COVID. So this is a moment in time where we have to bring it under control, and the government will take what action is necessary to do so.
OK, but we know the whole point of bringing in measures is to have them work. We had the rule of 6 brought in. Within a week, we had the 10 p.m. curfew brought in, and we may well see other measures brought in really soon. We're never getting a chance to see which of these measures actually works, are we? Because if we know there's a 3-week lag in terms of whether or not whether people have started obeying a rule and whether or not that leads to saving people's lives. In which case, we're never going to know which measures work. We're never going to go through that learning experience, which other countries have done by bringing in measures 3 weeks at a time. So, and we also know that an awful lot of these measures, certainly the 10 p.m. curfew, never even put to stage. They never even were asked. The scientific and advisory group, who are supposed to actually be examining whether or not a policy could save lives or not, they were never even asked. Perhaps if they were, they might have pointed out that people would just leave all the pubs at 10 o'clock. They'd be back on the streets and they'd be mixing and mingling and going home and mixing and mingling there and just as much at risk, and that the policy was utterly ridiculous in terms of saving no lives but costing many thousands of businesses their livelihoods. I mean, what scrutiny is actually happening scientifically and medically of government policy right now?
Okay, so I'll just try and unpick some of the things in what you just said there. So one thing that's happened over the last few weeks and months is that we have seen in parts of the country there have been higher rates of COVID. So, for instance, in August, we saw the rates go up in Leicester as one example, and extra measures were introduced. And you're right, there was a lag, but then we saw the rates come down in Leicester again. So people have made the sacrifices that unfortunately these restrictions involve, and then there was the impact and the rates come down. So we have seen where we've been able to do these localised responses, the impact of the measures. One really valuable source of information to us is the test and trace system. So it's hugely important that people, when they're tested positive, and they provide the contact details, and that helps break the chains of transmission. But the other thing from the test and trace system is that it provides us with information about how the virus is spreading. So we know, for instance, that in some places it's been particularly spread in people's homes, and when there have been social gatherings in people's homes. And that's one reason why in the parts with higher rates in the north of England, one of the particular restrictions has been to say you can't gather with people outside your own household in your home, because that's where we've seen the reports of that's where people are getting the infection.
But we actually know that the virus is mostly spread at home in people's own families.
Well, of course, the number one place where you're likely to get it is from somebody you're living with, because you're in closest contact. And if you weren't in contact with any other household, then it simply wouldn't spread between households. But unfortunately, people do need to have contact. People do need to still go, for instance, to work. So what we have to do is the wider social distancing measures, so that we can still get on with life as much as possible while controlling.
Okay. And is it tenable to lock down tens of thousands of students but not lock down our care homes? So young people who have virtually no chance of needing to go to hospital, let alone of dying of coronavirus, being told to sort of lock down and self-isolation for weeks on end, while our care homes are seeing an outbreak of cases. And the only measure, as far as I can tell, that's new is that your boss, Matt Hancock, the Health Secretary, is going to send 11,000 iPads in for dementia patients to use to talk to their families. I don't know if you've been in any care homes lately, but I'm not sure that's going to be much use. Is it really tenable to have a policy that locks down young, healthy people while failing to protect the elderly?
So I'll talk about students first, and then I'll come to care homes. So with students, where we've got students going back to university or starting university for the first time, and we want students to be able to have the best possible university experience, while of course there are restrictions. So for most students, we want them to be able to be having some face-to-face tuition, yes, some tuitions online, to be socially mixing but socially distanced, and for that to be still a good experience, if not all the fun that you'd have when we're not in a pandemic. But we have got the situation where in some universities you've got outbreaks, and like in any essentially household where you've got somebody who's got symptoms or who's tested positive, students, if they have symptoms, need to go and get a test, and then the household that they're with, or the group that they're with in halls which have been divided up effectively into households, does need to isolate, because that's how you control the outbreak. And you say, well, students aren't much at risk. So I'll say a couple of things. One is, unfortunately, although the majority, particularly of young, fit, healthy people, get COVID as a mild case, we're seeing in some this thing called long COVID, which means that after you've recovered, unfortunately, you still continue to get some really unpleasant health effects.
Let's lock down a country because people feel unwell. I mean, this is an absurd argument.
Well,
okay.
I think actually from some of the people I've heard from who have this thing called long COVID, I mean, literally find they can't get out of bed weeks later. I wouldn't.
So let's lock down a country because some people can't get out of bed. Genuinely, is that a government policy now?
No, that's absolutely not what
exactly.
I said.
It's irrelevant. It's very, very sad, but it's irrelevant. There are lots of people who can't get out of bed right now because they're not getting cancer treatment, Helen, with all due respect.
Can I just answer? Well, the second part of your question was about care homes, and we have made and are taking huge steps to protect care homes, which includes supplying them with PPE, giving them a further 500 million of funding to cover the extra costs of infection prevention control. So, for instance, have staff only working in one place rather than between care homes, which we know is one cause of the spread of the disease. But there is a connection between the students actually and the care homes, which is if we see COVID rates increase in our communities, well, care home staff live in communities. They have children. They may have children who are students. They have to go out and about in their lives. There is a greater risk that they themselves may catch COVID. And despite all their best efforts, all the use of PPE, all the infection prevention control, when you have staff with COVID, that means greater risk to the residents. So that is one reason why.
But this all comes down to test and trace, doesn't it? It all comes down to, if you're able to test and trace all the, kids at school, the teachers, test and trace the students immediately, test and trace all of the staff working in care homes. This would all be resolved because you'd be able to identify people very quickly. And if you had a test, which frankly was worth the paper it's printed on, which there are big question marks about, you'd have to test every single positive test twice to be sure they were actually positive because of the false positive rate. If we had such a test and we carried it out on that basis, we'd be able to do all of this. But does this not all fundamentally come down to the abject failure of this test and trace system?
Well, actually, I completely disagree, both with your comments about the accuracy of the test, which is highly accurate, and also about the testing system, where we've gone up from March, where we had 2,000 tests a day, to now over 200,000 tests a day. Specifically in care homes, following the guidance from SAGE and the clinical experts, we are testing care home staff weekly. And that means that that's
a lie. That's not happening in most care homes. I know. I've got an aunt in a care home. She herself has had 2 tests the entire time, the whole 6 months, and the care home staff have not been tested weekly. That is simply not true, Minister.
We are providing over 100,000 tests a day to care homes so they can test weekly, and for some care homes where if they're not testing their staff weekly, local authorities, rights of the public are working with them to increase those testing rates. Many care homes are testing their staff weekly and their residents every 28 days. It's a bit harder with residents, particularly those who have dementia, who can find it upsetting and confusing. But the critical thing is with the staff. But what we are also seeing from those testing results is a significant proportion of the staff who test positive actually don't have symptoms, which is why, yes, the testing is really important, but you will always have a period of time in between the weekly tests, for instance, where there is a risk somebody might be positive but not realise it. And that's why keeping the rates down across the whole community is so important.
All right, we'll leave it there. I know you have to go. Helen Whately, Health Minister, Responsibility for Care, thank you very much indeed for joining us.